Hello everyone, thanks for clicking onto our video. Did you know that in 2021, 1 in 10 people in Hong Kong suffer from diabetes? Type 2 is the most common, which occurs when the body lacks insulin, a hormone that carries glucose into cells to give us energy. A shortage of it results in excess glucose in blood. So, what are the causes?
For physical factors, genetics as well as obesity can cause insulin resistance. Excess glucose in your liver or blood are turned into fat cells, replacing liver cells over time, which develops into fatty liver disease and heightens the risk for diabetes.
Next is the social factors. Many might not be educated on the significance of this disease or have access to nutritious foods. A study has shown that individuals with lower income and education are 2 to 4 times more likely to develop diabetes than others. Poverty is a core cause as well. People who are rather poor suffer from a lack of resources to afford proper health care. Diabetes could also advance with lifestyles, such as dietary choices or physical activity levels, escalating the risk of developing diabetes.
Next, we're going to look at how culture plays a part. Diabetes can be influenced by one's religion. To begin, different religions such as Buddhism and Hinduism lead to a diversity of diets. Many of them there are different risk factors for them. Religious beliefs can also impact how patients cope with the stress of diabetes, as people might be unwilling to switch from the lifestyle they have grown up with.
How well do you know the traditional Asian diet? White rice, our staple food, can double the risk of diabetes, while soy sauce and salts have overly high sodium levels. Nonetheless, our traditional diet contains many cruciferous vegetables, like broccoli, as well as soybeans, which help decrease blood glucose.
Your beliefs and attitudes towards diabetes can also affect its development. Some people who are religious might believe that their illnesses are in God's hands, which means that they are less likely to change their lifestyle, even if it could cause them harm. People who believe diabetes wouldn't affect their life will also refuse to change their habits, as well as ignore warnings. This will lead to them having an increased rate of getting diabetes and harder treatment.
Firstly, let's look at the rich versus the poor. In 2019, 3 out of 4 adults with diabetes live in low and middle income families, demonstrating how this disease is more common in developing countries which lack access to good diet or healthcare. Research also suggests that both obese men and women have reduced physical and vitality scores compared to normal individuals. Paired with diabetes, women also feel more overwhelmed by the disease, possibly as they experience more body pain compared to men.
How does diabetes affect our body? In terms of nerve damage, you might lose your sense of touch or even movement in the forelimbs, as well as organ dysfunction. Poor treatment of diabetes can cause impairment, such as blindness, tooth decay, and clawed toes. Not only is kidney and liver disease possible, but people with diabetes are 2 to 4 times more likely to die from a heart attack.
Moving on to social impacts. High or low blood sugar decreases work productivity, hindering them from generating sufficient income. The constant need to monitor blood sugar levels can also cause depression or anxiety. Economically, diabetes is one of the most costly medical conditions worldwide. The annual total cost for diabetes in Hong Kong is around 14 to 16,000, with the government covering almost 80% of the costs. Medication and insulin injections are also costly.
So how can we prevent diabetes? Firstly, we should eat more vegetables and fruit in our diet, as well as nuts and fish, which contain healthy fats. On the other hand, sugars, fats, and salts should be cut to reduce the risk of diabetes.
Second is to maintain an active lifestyle by exercising regularly and building good habits.
Diabetes is a threatening issue, and it is up to every one of us to make a change. Thanks for watching our short video, and please head over to the link below to complete a short questionnaire.